You wake up in the middle of the night from a burning tingling in your hands. Your fingers have gone numb so much that you can't even clench them into a fist. You shake your wrists, trying to regain sensitivity, but relief comes slowly, painfully slowly. After a few minutes, the tingling subsides and you fall asleep again. But in the morning, your hands feel weak, awkward, as if they no longer belong to you. If this happens to you night after night, know this. Your body is desperately trying to warn you of a serious danger that is slowly destroying your nervous system and circulation. My name is Aristarch Ignatievich Vavilov, and in 40 years of medical practice, I have seen thousands of patients who ignored this warning. Some of them lost the ability to hold a spoon or button their shirts. Others ended up on the operating table with nerve compression that could have been prevented. Today, I will reveal to you the true reason for nighttime numbness in the hands, and it's not what doctors tell you in clinics. You will learn 5 methods that will stop the progression of this condition and restore strength and sensitivity to your hands. You will receive an exact exercise plan to follow every day, a list of foods that restore nerve conductivity, and an ancient recipe that costs pennies but works better than any pills. First, let's understand what is really happening in your hands every night. Most people think that numbness is caused by an uncomfortable sleeping position or that they slept on their arm. This is a dangerous misconception. When you sleep, your body enters recovery mode, blood flow slows down, and blood pressure drops. And it is at this moment that what was hidden during the day under the mask of normal well-being manifests itself. Nighttime numbness in the hands is not just discomfort. This is a symptom of a disorder that affects the peripheral nerves and blood vessels supplying your hands with oxygen and nutrients. The medical term for this condition is carpal tunnel syndrome. But here lies the first mistake of modern diagnosis. Doctors focus only on the wrist, where the median nerve passes through a narrow canal formed by bones and ligaments. They tell you that the nerve is compressed, prescribe anti-inflammatory medications, or even suggest surgery. However, in 70% of cases, the true cause of the numbness is located elsewhere, in the cervical spine, in the thoracic outlet, in the condition of your blood vessels, and even in your intestines. Let me explain the mechanism in more detail. Nerve roots branch off from the spinal cord in the cervical vertebrae, forming the brachial plexus, a large network of nerves that supply the entire arm. These nerves pass through narrow spaces between the neck and shoulder muscles, then descend along the arm, passing through several potential compression points. The first point is the gap between the anterior and middle scalene muscles of the neck. When these muscles spasm due to poor posture, stress, or cold exposure, they compress the nerves and subclavian artery. The second point is the space under the pectoralis minor muscle, where nerves and vessels pass to the axilla. The third point is the wrist itself, where the median nerve passes through the carpal tunnel. But here's what doctors rarely mention. Compression of the nerve at one point makes it more vulnerable to compression at other points. This is called double or triple compression syndrome. Imagine a garden hose pinched in 3 places. Even if you relieve one compression, water still won't flow freely until all 3 points are freed. That's why wrist surgery often does not provide relief to patients. Surgeons expand the carpal tunnel, but the nerve remains compressed in the neck and under the pectoral muscle. Now add to this the vascular component. With age, the walls of the arteries lose elasticity, cholesterol deposits accumulate on them, and the lumen narrows. The subclavian and ulnar arteries, which supply blood to the arm, also suffer from this process. At night, when the heart beats slower and blood pressure drops, blood flow through these narrowed vessels becomes very weak. The tissues of the arms begin to experience oxygen starvation, hypoxia. Nerves are particularly sensitive to a lack of oxygen. When a nerve does not receive enough blood, it starts sending chaotic signals to the brain, which you feel as tingling, burning, or complete numbness. There is another factor that almost nobody talks about: lymphatic congestion. Your lymphatic system is a network of vessels that collects interstitial fluid, toxins, and waste products from tissues. Unlike the circulatory system, the lymphatic system has no heart to pump the fluid. Lymph moves thanks to muscle contractions and joint movements. When you sleep motionless for 8 hours, lymph can pool in the tissues of the arms, creating swelling. This swelling compresses the already narrow spaces through which nerves pass, exacerbating their compression. Now let me tell you about the most common mistake people make with nighttime numbness in their arms. They start sleeping with their arms hanging down, thinking it will improve blood flow. In reality, this position creates even more tension in the shoulder girdle and increases nerve compression in the thoracic outlet. Another mistake is taking diuretics before bed. Many elderly people take diuretics to lower blood pressure or reduce leg swelling. However, these medications deplete potassium and magnesium electrolytes from the body, which are critically important for normal nerve conduction. Magnesium deficiency exacerbates muscle spasms and makes nerves hypersensitive. The third mistake is ignoring the connection between hand numbness and the condition of the cervical spine. If you have osteochondrosis, protrusions, or herniated cervical discs, the nerve roots are constantly under pressure. During the day, you don't notice it because you move, change positions, and your muscles support your spine. But at night, when the muscles relax, nerve compression increases several times. So what actually causes all these disorders? Let's analyze the 5 main reasons that doctors and clinics usually overlook. The first reason is poor workplace ergonomics and repetitive movements. If you have spent years working at a desk, typing on a keyboard, holding the phone between your ear and shoulder, or performing repetitive hand movements, you have systematically injured your nerves and tendons. Each repetitive movement creates microtrauma. Over time, these micro-injuries accumulate, causing inflammation and thickening of the tissues inside the carpal tunnel. The ligaments become stiff, the space narrows, and the nerve gets trapped. The second reason is chronic tension in the neck and shoulder muscles. Modern life forces us to constantly tilt our heads forward while looking at our phones or computers. This posture, known as text neck, places enormous strain on the cervical vertebrae. When the head shifts forward by just 2 centimeters, the load on the cervical spine increases by 5 kilograms. The neck muscles tense up, trying to hold the head, go into chronic spasm, and compress the nerves of the brachial plexus. The third reason is impaired circulation and atherosclerosis. After the age of 50, most people begin to experience atherosclerotic damage to the arteries. Cholesterol plaques accumulate on the walls of the vessels, reducing their lumen by 30, 40, and sometimes even 50%. Blood flows more slowly. Tissues receive less oxygen. At night, this deficiency becomes critical. Add to this the increased viscosity of the blood that occurs with dehydration, diabetes, or the use of certain medications, and you have the perfect conditions for nighttime numbness. The fourth reason is a deficiency of B vitamins, especially B6, B12, and folic acid. These vitamins are absolutely essential for the health of the nervous system. They are involved in the synthesis of the myelin sheath of nerves, the protective covering that ensures the rapid transmission of impulses. Without sufficient amounts of B vitamins, nerves become exposed, like wires with damaged insulation. They begin to send false signals, causing tingling, burning, and numbness. A deficiency of B12 is particularly dangerous because its reserves in the body are depleted slowly, over years, and symptoms appear only when nerve damage is already significant. The fifth reason is that doctors almost never check for hormonal disorders and fluid retention. In women during menopause and postmenopause, estrogen levels decrease, leading to fluid retention in tissues. Swelling is particularly pronounced at night when the body is in a horizontal position and fluid is distributed evenly throughout the body. This swelling compresses nerves in narrow anatomical spaces. In men, a similar problem can be caused by a decrease in testosterone and disruption of water-salt balance. But here's what I haven't told you yet, and it may come as a revelation. In my practice, I have encountered patients for whom nighttime numbness in the hands was the first symptom of serious systemic diseases: diabetes, hypothyroidism, rheumatoid arthritis, and even multiple sclerosis. Therefore, if the numbness appeared suddenly, is progressing rapidly, or is accompanied by other symptoms such as weakness, changes in coordination, or speech disturbances, this is a reason to immediately consult a doctor for a complete examination. Now that you understand the true causes of your condition, let's move on to the solution. I am going to give you 5 methods that work together to eliminate all points of nerve compression and improve blood circulation in the hands. Method 1. Exercises for nerve release. This technique is called neurodynamic mobilization or nerve gliding. The essence is that the nerves in your body are not rigidly fixed. They should glide freely through tunnels and between muscles when you move. When a nerve gets stuck due to inflammation or scar tissue, every movement causes pain and intensifies numbness. Special exercises help restore this gliding. Here's how to perform the basic exercise for the median nerve. Sit on a chair, back straight, feet on the floor. Extend your right arm to the side at shoulder level, palm facing forward, fingers pointing up. Now slowly turn your head to the left, away from the extended arm. You should feel a gentle stretch along the inner side of your arm from the armpit to the fingers. Hold this position for 2 seconds. Breathe calmly. Then bend your fingers and wrist down while simultaneously turning your head back toward your arm. This is one complete nerve glide. Repeat 10 times slowly without jerking. Then do the same with your left hand. The second exercise is for the ulnar nerve, which is responsible for the sensation in the pinky and ring fingers. Bend your right arm at the elbow, bringing your wrist to your ear as if holding a phone, palm facing you. Now slowly tilt your head toward your left shoulder while straightening your arm down and turning your palm away from you. You will feel a stretch along the inner side of your forearm and in the elbow. Return to the starting position. Repeat 10 times on each hand. The third exercise for the radial nerve. Stand up straight, let your right arm hang down by your side. Turn your palm backward, then bend your wrist so that your fingers are pointing down and back. Now slowly tilt your head toward your left shoulder. You will feel a stretch along the outside of your arm. Hold for 2 seconds, then return to the starting position. Repeat 10 times on each hand. Perform these 3 exercises twice a day, in the morning after waking up and in the evening before going to bed. For the first week, do 10 repetitions of each exercise. From the second week, increase to 15 repetitions. By the end of the first month, you should be doing 20 repetitions. You will notice a reduction in numbness within 5 to 7 days of regular practice. The second method is trigger point massage in the neck and shoulder muscles. Remember, I mentioned the scalene muscles in the neck that compress the nerves? These muscles often contain trigger points, painful knots of tension that maintain chronic spasms. Releasing these points provides immediate relief. Locate the anterior scalene muscle. Place your fingers on the side of your neck, just above the collarbone. Slightly tilt your head forward and to the side, feeling the vertical band of the muscle tighten under your fingers. Find the most painful point within this muscle. Apply pressure to it with the tips of 2 fingers with moderate force. You should feel discomfort, but not sharp pain. Hold the pressure for 30 seconds, breathing deeply and slowly. With each exhale, try to relax your neck a little more. Then release, rest for 10 seconds, and repeat 2 more times. Work on both sides of your neck. Now locate the pectoralis minor muscle. It is located under the collarbone, just below the outer edge of the pectoralis major muscle. Lie on your back, bend your right arm, and place your palm on your forehead. With your left hand, feel the area under your right collarbone, closer to your shoulder. Press with your fingertips toward your spine. You will feel a tightness in the muscle and possibly sharp tenderness. Hold the pressure for 30 seconds, rest, and repeat 3 times. Then work on the left side. Perform this self-massage every evening before bed. After 2 weeks, the muscles will start to relax and nerve compression will decrease by 30 to 40%. Method 3. Contrast hand baths before bed. This simple method significantly improves circulation and reduces swelling. Prepare 2 bowls of water. The first should have warm water, about 40 degrees, not hot enough to burn. The second should have cool water, about 18 to 20 degrees. Add 2 tablespoons of sea salt or Epsom salt, magnesium sulfate, to the warm water. The salt enhances the anti-inflammatory effect and helps magnesium penetrate through the skin. Submerge both hands in the warm water up to the elbows. Hold for 3 minutes, slowly clenching and unclenching your fists. Then immediately move your hands into cool water. Hold for 1 minute. Back to warm for 3 minutes, then to cool for 1 minute. Repeat the cycle 5 times, ending with cool water. After the procedure, thoroughly dry your hands and apply any nourishing cream with massaging movements from the fingertips to the shoulders, helping lymph to move. Contrast baths train the vessels, causing them to alternately expand and contract. This restores the tone of the vascular wall and improves microcirculation. Cool water at the end of the procedure prevents excessive blood flow to the hands at night and reduces swelling. Perform this procedure daily before bedtime for a month. You will notice that you wake up with numbness much less often after just a week. Method 4. Dietary changes for nerve recovery. Nutrition plays a huge role in the health of the nervous system. You need to radically increase your intake of foods rich in B vitamins, magnesium, and omega-3 fatty acids. Vitamin B6 is found in chicken liver, beef liver, mackerel, beans, and walnuts. Eat liver twice a week, 150 grams each time. A handful of walnuts, 30 grams every day. Vitamin B12 is only found in animal products such as beef liver, sardines, eggs, and cottage cheese. If you do not eat enough of these foods, take a B12 supplement in the form of methylcobalamin, 1,000 micrograms daily. Magnesium is critically important for muscle relaxation and nerve impulse transmission. The best sources are pumpkin seeds, dark chocolate with over 70% cocoa content, spinach, avocado, and almonds. Eat 2 tablespoons of pumpkin seeds every day. If you have cramps or frequent muscle spasms, take magnesium citrate or magnesium glycinate 300 to 400 milligrams before bedtime. Omega-3 fatty acids reduce inflammation and improve the myelin sheath of nerves. Eat fatty fish like mackerel, herring, and salmon 3 times a week, or take quality fish oil with 2,000 milligrams of EPA and DHA daily. Completely eliminate foods that increase inflammation and worsen circulation. White bread, baked goods, sugar, fried foods in sunflower oil, sausages, hot dogs, and smoked meats. These foods increase the level of inflammatory cytokines in the blood and accelerate the development of atherosclerosis. Method 5. Evening ritual to prevent numbness. 1 hour before sleep, perform the following sequence of actions. First, drink a glass of warm water with a teaspoon of honey and a pinch of cinnamon. This will prevent nighttime dehydration, which thickens the blood. Second, do 3 nerve gliding exercises that I described above. Third, perform contrast baths for your hands. Fourth, lie on the floor or a firm bed, placing a small towel rolled into a cylinder under your neck. Lie like this for 5 minutes, allowing your cervical spine to relax and straighten. 5 minutes before going to bed, take the correct sleeping position. Sleep on your back or side, but never on your stomach, as this position creates maximum tension in the neck. If sleeping on your side, place a pillow between your arms at chest level so that the upper arm rests on the pillow rather than hanging down. This prevents nerve compression in the armpit. Use an orthopedic pillow that supports the natural curve of the neck, not too high and not too flat. If you wake up at night with numbness, do not shake your arms abruptly. Instead, slowly raise them up and make gentle circular movements at the wrists and elbows. Then place your hands on your chest and slowly massage from the wrist to the shoulder, helping blood return to the limbs. After 2 to 3 minutes, the numbness will subside. It is now very important to understand when these methods are safe and when caution is required. If you are taking blood-thinning medications such as warfarin, clopidogrel, or aspirin, intense trigger point massage may cause bruising. Perform the massage with less pressure. If you have a pacemaker or have had heart surgery in the last 3 months, avoid contrast baths as they put additional strain on the cardiovascular system. Nerve gliding exercises are completely safe, but if you feel a sharp shooting pain while doing them, stop immediately. This may indicate that the nerve is severely damaged or pinched, and you need to consult a neurologist. If numbness is accompanied by weakness in your arm so severe that you drop objects, or if the numbness spreads to your face or tongue, these are signs of a serious neurological disorder, possibly a stroke. In this case, call emergency services. Start applying all 5 methods gradually. For the first week, do only nerve exercises in the morning and evening. Starting from the second week, add trigger point massage in the evening. From the third week, begin contrast baths. At the same time, change your diet by eliminating harmful products and adding beneficial ones. By the end of the first month, you should be performing the full evening ritual daily. Let me tell you the story of one of my patients. Lydia Mikhailovna, 62 years old, came to me with complaints of daily nighttime numbness in both hands, which had been tormenting her for 3 years. She would wake up 4 to 5 times a night, shaking her hands for 10 minutes before feeling sensation return. During the day, she felt constant weakness in her fingers, struggled to open jars, and couldn't thread a needle. She visited 3 doctors. The first prescribed anti-inflammatory pills, which caused stomach pain and did not help. The second suggested corticosteroid injections in the wrist, but after 3 shots, the numbness returned. The third recommended surgery. I conducted an examination and found pronounced tension in the neck scalene muscles on both sides and painful trigger points in the small pectoral muscles. The test for compression of the brachial plexus was positive. I explained to Lydia Mikhailovna that the problem was not in her wrists, but in her neck and shoulders. I gave her the same 5 methods that I just described to you. For the first 3 days, she was skeptical, but performed the exercises. On the 5th day, she slept through the night without waking up for the first time in 3 years. After 2 weeks, the numbness had almost completely disappeared. After a month, her strength in her hands returned, and she could once again embroider and cook without discomfort. Now a year has passed, and she continues to do the exercises every evening because she knows it protects her nerves from recompression. Now I want to ask you for help. If the information in this video has been valuable to you, please hit the like button below the video. This simple action helps YouTube's algorithms show this video to more people who suffer from nighttime hand numbness and are desperately seeking a solution. Your like might save someone from unnecessary surgery or years of sleepless nights. Leave a comment below and tell me which of the 5 methods you will try first. Describe your experience with hand numbness, how long it lasts, at what time of night the numbness is strongest, and which fingers are affected the most. I read every comment and often respond with personalized recommendations based on your specific symptoms. Subscribe to the Health Hour channel and be sure to click the bell next to the subscribe button to activate notifications. This way, you will never miss important health information that could change your life or the life of your loved ones. Every week, I post new videos on issues that concern people over 50 and provide practical solutions that work. Share this video with friends and family who complain about numbness in their hands at night. Send them the link via messenger or email. You could literally save someone from chronic pain and loss of hand function just by sharing this knowledge. In the next video, I will reveal the shocking truth about a common drink that quietly destroys your joints, causing arthritis and osteoporosis. You will learn 3 simple substitutes that will restore cartilage tissue and eliminate the pain that has plagued you for years in just 6 weeks. This is information that orthopedic surgeons don't want you to know because it makes their expensive procedures unnecessary. Don't miss this video. Take care of your health and remember, your body is capable of healing at any age if you give it the right tools.